Welcome to ICD-10-CM Part 3. I'm Mrs. J, one of the curriculum developers here at AMCI. Let's get started. Previously, we discussed ICD-10-CM conventions, general coding guidelines. We gave you scenarios to test your knowledge, and hopefully, we've brought you one step closer to ICD-10-CM coding mastery. Now, if you haven't viewed parts 1 and 2, now is a good time to do so. Then come on back. And in this presentation, we will discuss, we're going to review ICD-10-CM categories, the tabular list, and we're going to give you the AMCI technique to learn how to memorize these categories. We're going to give you a slight technique. You probably won't remember everything, but you will remember something. And hopefully, we'll bring you one step closer to ICD-10-CM coding mastery.
And before we go any further, let's go ahead and read the copyright. CPT is a registered trademark of the AMA. Keyword concept, FTR, CHUN, AMCI Fab 7, AMCI Flip Tap, and MCG are all registered trademarks of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC, and the credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA, and AMCI does not own the rights to these credentials.
The tabular list. This is what I call the verifier because we have to verify everything that we've looked up in the tabular list. So just to kind of give you a little background, ICD-10-CM has 22 chapters, and these chapters house all of the codes whose categories are from A to Z. Now at AMCI, we've determined that if students can remember the category just looking at the first letter of the category, then they should have an advantage when taking the coding certification exams. Now, let's talk a little further. Remember, coders, in part 1 when I showed you the color pages? Yes, these color pages inside that purple box. This represents the tabular list. This is where you will verify the code once you find it in the index. And very, very important, coders, remember, there are guidelines in your tabular list. So the tabular list is important. Now, in this presentation, in a fun way, we are going to learn these categories on site. You will learn AMCI's word associations for these categories. Again, at AMCI, we believe if students can remember the categories, they should have an advantage when taking the coding certifications exams. Now, coders, who does that mean? That means you. Yes, you can have an advantage. Now, why do we think students have an advantage if they learn the categories on site? Well, if you didn't know, most medical coding exams are timed and are multiple choice. And if you learn categories on site, it will save you time on those multiple choice timed exams. Now, this is huge. It's huge because time is the #1 reason most people don't pass the certification exams. They will tell you themselves they didn't have enough time. Well, if you don't know, You're going to know now. At AMCI, we integrate time-saving techniques in your coding instruction, like right now. Look at this scenario. By the end of this presentation, you will be able to solve this scenario without looking in your coding manuals. Well, most of you. Well, a significant number of you will. And if you don't, it's okay. You just may need a little more practice, but you will get it. All right, coders, let's get started. All right, let's take a look. We've said that there are 22 chapters in the tabular list. We know that, but let's just kind of quickly look. You got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 right before you. And on the next page, you have 11 through 22. Now, I'm not going to read all of these because I'm going to do it on the next slides. In fact, we're going to go through each chapter and I'm going to give you some sight words to help you remember. All right, let's get started. We're going to begin with you know what? I don't want to go any further without shouting out the AMCI students who helped us come up with this word association list. You rock, AMCI students. Indeed you do. I want to thank you. I want to thank the AMCI instructors. You all did an amazing job. Now let's start with the letter A. In Chapter 1, the category codes begin with the letter A. You will find all infectious diseases in this chapter. Certain infectious and parasitic diseases. When we think of infectious diseases, what do we think of? Well, if you said AIDS because it's on the screen, indeed, we think of AIDS. And this category begins with A, just like the word AIDS. So when you think of Chapter 1, think of A is for AIDS, and it is an infectious disease. Okay, coders, so do you see where I'm going? Think about it. Infectious diseases, think about AIDS. AIDS begins with the letter A. All right, let's move on to Chapter 2. Chapter 2 category codes begin with the letter C. You will find neoplasms-related diseases in Chapter 2. When we think of neoplasms, think of cancer. Yes, that's what a neoplasm is. And the category begins with C00 through D49. So when you think of Chapter 2, think the letter C is for cancer. Next chapter. In Chapter 3, all of the category codes begin with the letter D. You will find diseases of the blood and blood-forming organs and certain disorders involving the immune mechanism in this chapter. And it begins with D50 through D89. So when we think of diseases of the blood and blood-forming organs, think of the letter D. And D is for drawing of blood to determine vitamin D levels. When you think of D, think of blood. All right, so anytime you have a blood disease or illness, it should be in the D category. Chapter 4 category codes all begin with the letter E. E is for endocrine. nutritional, and metabolic diseases. So if you have any endocrine condition, it's going to be under Chapter 4, and it's going to begin with the letter E. Now, the code series is E00 through E89, and when you think of E, endocrine, think of diabetes. Hear that long E in diabetes? Diabetes is probably one of your most common endocrine diseases that you'll be coding for. So when you think of E, think of diabetes and think of any endocrine related disease. Chapter 5. Chapter 5 is the chapter for mental, behavioral, and neurodevelopmental disorders, category F01 through F99. When we think of mental health, we think of the letter F. Letter F is for Freud, Sigmund Freud. He's the father of psychoanalysis. Psychoanalysis is used to identify and treat mental health disorders. And this category begins with F01 through F99. So when you think of mental and behavioral and neurodevelopmental disorders, think F for Freud. Okay, next up. Chapter 5, Diseases of the Nervous System and Sense Organs, G00 through G99. You will find diseases of the nervous system in Chapter 6 that begins with the letter G. And just like your nerve pain when you chew too much gum and nerve pain in your gum. See where I'm going? Think of nerves, think of G, the letter G, and G is for gum, causing the nerve pain. Ouch. All right, let's move on to Chapter 7. All right, coders, we have two diseases that share a category. Two diseases that share a category. This is good because they kind of, it's not hard. They kind of relate. So, Chapter 7 diseases, diseases of the eye and adnexa code series H00 through H59. When you have eye conditions, they begin with the letter H. When you think of eye conditions, think of hyperopia. Hyperopia is another term for farsightedness. When you hit your 50s, you're going to know what I mean. H is for hyperopia, and H houses all of the diseases of the eye and adnexa. Chapter 8, Diseases of the Ear and Mastoid Process, code series H60 through H95. When we think of hearing disorders, because H is for hearing, think of disease. Anytime you have a hearing disorder, it's going to begin with the letter H, a disease of the ear and mastoid process. Chapter 9, circulatory conditions all begin with the letter I. When you think of circulatory heart stuff, think of I, as in acute myocardial infarction like heart attack. I, diseases of the circulatory system, and the code series is I00 through I99. And if you want to know what infarction is another term or the clinical term for tissue death. When you have a heart attack, often when the artery becomes blocked, it results in death of a tissue. That is what an infarction is. If you have a stroke, you have an infarction. The brain tissue results in death as well. Chapter 10 diseases begin with the letter J, and Chapter 10 diseases are diseases of the respiratory system. So what does J and the respiratory system have in common? Well, jumping. If you jump, 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 you can get or it can cause a asthma attack, right? Well, for some people, if they overexert themselves like jump, it can cause an asthma attack. Asthma is a common respiratory system disease, and the code series is J00 through J99. Chapter 11 are diseases of the digestive system. Diseases of the digestive system begin with category letter K, K00 through K95. Now, coders, this is what I say. You don't have to follow it, but I think that the digestive system looks like the letter K. I do. I just do. Hey, that liver over there looks like the letter K to me. But some of the students said, hey, Mrs. J, I don't like that. I think kick in the stomach. Yes, your stomach is a part of your digestive system. If that works well with you, then let it fly. But I'll tell you, people think that the digestive system looking like the letter K is so far-fetched that they remember it. Okay, so when you think K, think diseases of the digestive system. All right, chapter 12. Chapter 12 is the category for diseases of the skin and subcutaneous tissue. The category begins with L00 through L99. So when you think of diseases of the skin, think letter L. And what sight word begins with the letter L? Well, lesions. Skin lesions begin with the letter L. So when you think of L, think of skin lesions, or you can think of layers of skin. Yeah, L is for lesions, L is for layers of skin, and you know what? Both are diseases of skin and subcutaneous tissue. Chapter 13. Chapter 13. This category begins with the letter M, and Chapter 13 is diseases of the musculoskeletal system and connective tissue. Begins with M00 through M99. When we think of diseases of the musculoskeletal system, we think M is for muscle. Yeah, that's pretty straightforward. Okay, so when you see that M, think musculoskeletal. All right, let's move on to Chapter 14. Chapter 14, category letter N. This houses all of the diseases of the urinary system, the genital urinary system. So any disease of the genital urinary system can be found within code series N00 through N99. So you might say, what does N have to do with the genital urinary system? Well, when you think of N, think of naughty parts. Yes, so N houses all of the codes for naughty parts. I'm not going to go through that right now. You just have to look it up. All right, next chapter. Chapter 15. These codes begin with the letter O. Yes, O. And in this chapter 15, letter O chapter, you'll find a chapter on pregnancy, childbirth, and the puerperium. And the codes begin with O00 through O9A. All right, so when you think of chapter 15, the letter O is for obstetrics. Obstetrics. All right. I think some of you are getting this. Chapter 15. No, 16. Here we go. Chapter 16. These category codes begin with the letter P. you will find certain conditions originating in the perinatal period, code series P00 through P96. When we think of the perinatal period, we think of prematurity, right? We think of premature babies, and prematurity is a condition of the perinatal period. So P is for certain conditions originating in the perinatal period. Chapter 17. All right, Chapter 17 category codes begin with the letter Q. In Chapter 17, you'll find conditions that are housed under congenital malformations, deformations, and chromosomal abnormalities. When we think of these conditions, we think of question mark ear. A person can be born with question mark ear. That is a condition, a congenital malformation, and question mark begins with the letter Q. All right, so let's move on to Chapter 18. Oh, there's my baby. This is my grandbaby. He's got a question mark ear right here. But fortunately, his question mark ear went away. And you know what? I had a question mark ear too. Yeah, they do kind of reform if it's not like A or C. All right, so they kind of, I guess take the correct shape after a while. All right, next, Chapter 18. All right, Chapter 18 category codes begin with the letter R. In this chapter, you'll find symptoms, signs, and abnormal clinical and laboratory findings, not elsewhere classifiable. Code series R00 through R99. Now, when you think of Chapter 18, think of the letter R. And this is where you'll find clinical indicators like signs and symptoms, such as running back and forth to the bathroom because you have a urinary tract infection. Think R for signs and symptoms, not elsewhere classifiable. R is for running because you have a UTI. Chapter 19. All right, Chapter 19 codes begin with the letter S. This is where you'll find injuries, yes, poisonings, and certain other consequences of external causes. When you think of Chapter 19, think of the letter S, and S is for sprained ankle. It is a condition or within the injury, poisoning, and certain other consequences of external causes. All right, Chapter 20. All right, coders. Chapter 20 category codes begin with the letter V. These are not diagnoses. If you can recall, I did say these Chapter 20 codes, external causes of morbidity. These are the who. Yeah, it could be the who, the what, the when, the where, the how that injury or illness was caused. So if you were in a vehicle accident with a van and it caused your injury, think of V for external causes of morbidity. Code series V00 through Y99. Next up, Chapter 21. Chapter 21. Factors influencing health status and contact with health services. Code series Z00 through Z99. Category 21, of course, begins with the letter Z. These are not necessarily diagnoses. These are conditions or circumstances that influences your health status. For instance, a history of a disease or illness. Or an encounter, the reason the person is there, a type of encounter, or a type of birth. So these are not necessarily illnesses and injuries. However, they are factors influencing the health status or contact with health services. Another example, someone that has a routine physical, there are no illness or injuries. Okay, so this is letter Z. Now, when we think of Category 21 codes, we think of Z. Z for zombie, right? Because if you come in contact with a zombie, it will influence your health status. Yeah. Okay, that's stretching it. We didn't have anything. One of the students shouted that out on one of our social media pages. We're using it. This is all we got, so remember it. All right, we've got one more chapter. Coders, we made it. We made it to chapter 22, and the conditions in chapter 22 begin with the letter U. Okay, Mrs. J is a little giddy. That means I'm getting a little tired. U and 22 do rhyme, but this chapter is for codes for special purposes. Code series U00 through U85. And U is for ugly stuff. And coders, there are only two conditions that fall in this category. I believe that this is where new codes will start. Then they will be housed in their respective or appropriate category. That is just what I believe because it makes no sense for these two conditions to be here. Now, if we say ugly stuff, the most ugly thing that we can think of right now, one of them is COVID-19. Yes, you can find the code for COVID-19 in the U category, as well as vaping disorders. And if you haven't heard, vaping can really do some ugly damage to those lungs. So I think both of these fall in the right category. And also, COVID-19 is an infectious disease, right? So eventually, I believe COVID-19 will have an A designation. It will move on to the A category, and vaping causes respiratory illnesses. I believe that's going to go over to the what does respiratory? Mrs. J had a wow. I had a senior moment. Help me out, coders. What is respiratory? Okay, if you said J, jumping causes asthma, yes. Hey, those sight words work. You saw it. You saw it. This is real. I really didn't know. So it's J. That's where I believe vaping will go. All right, coders. Let's go ahead and apply what we've learned to practice. And we're going to do a quiz. It's called quizzes. It's a game. And while you study, I'm going to study too. I'm going to engage you with this game. So on the next slide, I will give you the instructions. Outstanding job, coders. Now let's do this. Okay, coders, let's play quizzes. All right, here are the instructions. Number one, a picture of a disease, illness, or injury will be displayed on your screen. You should just call out the category letter. Yes, whatever category that disease, illness, or injury falls in, call it out. I will give you additional clues to help you remember the categories. All right, and I will do my best. So, all I ask of you, do your best, and that is good enough. All right, coders, let's get started. Let's play quizzes. Did you like that, coders? I hope so. I always love quizzes, and hopefully it got your brain going and you memorized some of these categories. And some of you may have memorized all of them. All right, so let's review the chapters. You know I have to do it multiple ways. We have visual learners, we have auditory learners, we have tactile learners. So I'm going to get all of you. All right, chapter 1, certain infectious diseases. When we think of certain infectious diseases, we think of the letter A. A is for AIDS, and you can find them in category code range A00 through B99. Chapter 2. This is the chapter for cancer. Yes, code series C00 through D49. Chapter 3, diseases of the blood and blood-forming organs and certain disorders involving the immune mechanism. When we think of D, we think of drawing blood analysis for vitamin D. Code series D50 through D89. Chapter 4, this is your endocrine, your nutritional and metabolic diseases. E00 through E89. When we think of the letter E for chapter 4, it begins with the letter E, and we think of endocrine and diabetes, that long E. Yes, chapter 5. This is where you'll find your diseases for mental, behavior, and neurodevelopmental disorders. When we think of code series F01 through F99, we think of Freud. Yeah, the father of psychoanalysis and mental health disorder treatment. Chapter 6, these are diseases of the nervous system. The diseases of the nervous system begins with the letter G. G00 through G99, and G is for gum. Gum pain is terrible nerve pain. All right, chapter 7. Disorders of the eye and adnexa begins with H00 through H59. H is for hyperopia. If you didn't know, that's farsightedness. Chapter 8, diseases of the ear and mastoid process, H60 through H95. Diseases of the ear and mastoid process, think of hearing. Yes. Chapter 9, diseases of the circulatory system begins with the letter I. I00 through I99. When you think of circulatory system, think infarction. All right, I is for infarction and also the circulatory system. Chapter 10 begins with the letter J. J00 through J99 is the code series. J houses the diseases for the respiratory system, and doing jumping jacks can cause you to have an asthma attack. An asthma attack is a disease of the respiratory system. Chapter 11. All right, how many of you remembered this? I know some of you did. It's so far-fetched. This chapter houses the diseases of the digestive system. When we think of the digestive system, we think of kicking the letter K because the digestive system looks like the letter K, or a kick in the stomach. Digestive system's code series begins K00 through K95. Chapter 12. This is the chapter that houses the diseases of skin and subcutaneous tissue. When we think of diseases of the skin and subcutaneous tissue, we think of category L, L00 through L99, and L is for layers and skin lesions, skin layers and skin lesions. Chapter 13, diseases of the musculoskeletal system. Diseases that involve the musculoskeletal system begin with the letter M. M00 through M99. When we think of the letter M, we think of muscles for Chapter 13 diseases. Chapter 14 houses all of the diseases of the genitourinary system, and those diseases begin with the letter N. N00 through N99, and what reminds us of the N genitourinary system diseases? Well, those naughty parts, right, are naughty parts. Chapter 15, you'll find them in the chapter Pregnancy, Childbirth, and the Puerperium. And pregnancy conditions or pregnancy-related conditions are found, or they begin with the category letter O, O00 through O9A. And when we think of O conditions, we think of obstetrics, right? Chapter 16. Chapter 16 houses the conditions originating in the perinatal period. Perinatal conditions begin with the category letter P00 through P96, and P is for what? Premature baby, pediatrician, right? Perinatal period. All right. Chapter 17, congenital malformations, deformations, and chromosomal abnormalities. This is where you'll find all of those conditions, and these conditions begin with the letter Q, Q00 through Q99. An example of a Q condition is question mark ear. Chapter 18. This is where you'll find the symptoms, the signs, and abnormal clinical and laboratory findings not elsewhere classifiable. And these conditions begin with the letter R. R00 through R99. R is your code range, and R, an example of signs and symptoms of running to the restroom, are clinical indicators that suggest that a patient has a UTI. Chapter 19. Chapter 19 houses your injuries, poisonings, and injuries, poisonings, and certain other consequences of external causes. We'll say that these chapter 19 conditions begin with the letter S and ends with the letter T. An example is sprained ankle, right? Ankle sprain or any kind of sprain, any kind of injury. You'll find your injuries that live in chapter category S. Chapter 20, this is your external causes of morbidity. V00 through Y99, these are not illnesses or injuries, but this is the who, the what, the when, the where, the why that caused the accident. And a vehicle with a van accident is a good example of an external causes of morbidity or external cause. Next, Chapter 21, factors influencing health status and contact with health service providers. They influence your health status. And Z00 through Z99, when we think of anything that can influence our health status, we think of a zombie because they can do it. And finally, Chapter 22, these are codes for special purposes. U00 through U85. When we think of U codes, we think of ugly stuff. And that doggone COVID is in the ugly stuff category. All right, coders, did you learn anything? Did you learn any of the chapters? Not necessarily the chapter number, but the letter. Did you learn the letters and diseases that fall under that letter? All right, we'll see. Here's your scenario. Go ahead and see if you can solve it without looking up the diagnoses in your ICD-10-CM manual. You have a 13-year-old boy who arrives to the ED with ankle pain. He was running sprints and rolled his ankle. The ED physician diagnosed the patient with a fractured ankle. On site, without looking in your coding manuals, which code best describes the encounter? Okay, coders, I'm going to give you a few moments All right, coders. If you learned from this presentation, you should be able to solve this scenario 10 seconds after I've read it. All right, let me show you. All right, so if we look at our answers, A. Well, first, we are coding for a fractured ankle, right? Now let's look at our answers. If you can recall, A begins with the letter C. And if you can recall, C houses all of the conditions that begin or fall under the category of cancer, right? Now, did this little boy have cancer? If you say no, you are correct. So let's move on. Let's look at B. B begins with the letter K. If you can recall, K houses all of the conditions in ICD-10-CM that are related to the digestive system, right? Remember the kick in the stomach? Or remember the digestive system looks like the letter K? Now let's get back to our scenario. This patient has a fractured ankle. Does this condition fall under a K condition, under a K category? Absolutely not. C begins with the letter I. This category suggests that the patient had a circulatory problem or in something related to infarction. Infarction is an example of circulatory system. So fractured ankle, not circulatory system. However, D begins with the letter S. Yes, and this is where we house all of our injuries. Is a fractured ankle an injury? Outstanding. I know you said it, yes. All right, so hopefully you understand the importance of recognizing these categories on site and how it will give you an advantage when taking your medical coding exams. Now, hopefully you got it, and some of you may need a little more time, and it's okay. Just keep practicing your categories, and your new skill will develop over time. So always use this technique when you have multiple choice scenarios, specifically ICD-10-CM multiple choice scenarios, and you will be just fine. Okay, coders, now it's time to just go over what we learned today. We learned how to recognize some ICD-10-CM categories on site. We applied our knowledge to practice, and hopefully we've brought you one step closer to ICD-10-CM coding mastery. And coders, go ahead and apply this new technique. I use technique lightly, but it works. It does. All right. Okay, coders, you've done an outstanding job. You've completed part 3 of Introduction to ICD-10-CM. And on behalf of AMCI, thank you for watching. This concludes our presentation. Until next time.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around the world. AMCI, AMCI.